Acting Upper West Regional Minister has appealed to benevolent organizations to complement the efforts of government by supporting medical facilities like the Lawra Municipal Hospital. The Lawra Municipal Hospital, which launched its 90th anniversary on Thursday, still faces a myriad of challenges ranging from inadequate wards to lack of medical equipment to attend to patients and the needs that need urgent attention. Well, Amidu Chinyam said due to funding challenges, government alone could not do it and therefore requires partnership from key stakeholders to deliver quality health care to the people. Rafiq Salam was at the event and our reports.
At the launch of the 90th anniversary celebration of the hospital at Lawra, Municipal Health Director Dr. Bernard Ziem underscored the important role the hospital plays in the life of the people.
Overall, the hospital remains the most important referral center, receiving cases from over 25 health facilities scattered across the municipality, from Lisa in the northeast to Babli in the southwest, including residents who live across the Black Volta.
Though staff and residents are happy the hospital is 90, they are worried about the increasing number of challenges the facility faces. Dr. Justin Dakura is the medical superintendent of the Lawra Municipal Hospital.
In some cases, the equipment are inadequate or obsolete. It is crucial for these equipment, such as oxygen concentrators, patient monitors, suction apparatus, and others, to be provided in adequate numbers for efficient health delivery. In an area of technology, it is important for the operations of healthcare facilities to be ICT-driven to significantly reduce complaints of delays and bring efficiency in service delivery. Unfortunately, our operations are still manual and the facility is not networked, leading sometimes to complaints of long waiting time, wastage of resources, and other effects.
Acting Upper West Regional Minister Amidu Chinyam call on benevolent organizations to complement the effort of the government by supporting the hospital to provide quality care to the people.
Much as we give assurance of our continuous commitment to supporting the improvement of health infrastructure in this hospital, I wish to take this opportunity to appeal to stakeholders to complement government's effort by offering their support. Due to dwindling funding challenges, government cannot do it all alone and therefore will require partnership with critical stakeholders to improve service delivery in this facility and others in the region.
Paramount Chief of the Lawra Traditional Area, Napo Wole Kabo III, paid glowing tribute to the early staff of the hospital for the key roles played in the establishment of the hospital.
Nakabo I, both as a colonial civil servant in the 1920s and later as a chief from 1935 to the mid-60s, played a key role in the eradication of sleeping sickness and the development of the Lawra Hospital. Without his traditional backing for the clearing teams who took him to as far as Tumu, the sleeping sickness eradication program would have failed, as sacred groves along streams in most areas would have been left uncleared in dread of breaking taboos. In fact, the clearing would have been resisted by the people.
Reporting for JoyNews, Rafiq Salam, Lawra.
We take you to the Volta region, where 5 communities in the Afajato South district have been declared open defecation free after Plan Ghana initiated a project to promote good hygiene in 10 communities in the Volta region. The €1 million grant project, which spanned 3 years, enlightened residents of the beneficiary communities on the imperative role good hygiene plays in their well-being. At a ceremony to certify the 5 communities, residents trumpeted how the project had contributed to the reduction of cases of communicable diseases since they now have hygienic environment. Fred Kwame Sari has filed the following reports.
Open defecation was rampant in these 10 beneficiary communities in the Afajato South district and has led to the frequent outbreak of communicable diseases, with children being the worst affected. This was why the communities were chosen as part of the Plan Ghana Integrated Water, Sanitation and Hygiene Project, IWASH, aimed at promoting good hygiene. The IWASH project saw the construction of 9 female-friendly sanitary facilities in schools and had residents educated on the practice of hygienic lifestyles, among others. William Domapiele is the IWASH project coordinator.
With regards to the CLTS approach was used to trigger communities to create demand for household latrine construction. So in Volta region, out of the 10 communities, the Regional Interagency Coordinating Committee, which is the RICS, which is in charge of verifying and certifying communities, came out with only 5 of the 10 qualifying as ODF communities.
Liati Agbonyra, Liati Datem, Liati Soba, Have Ajekope, and Have Aveyoyue have been certified open defecation-free communities by the Ministry of Sanitation and Water Resources. The project has also started impacting positively on the health of residents, reducing cases of communicable diseases.
One important benefit derived from this project is that the introduction of hand washing and the running water with soap prevents us from many diseases. It also helps us to save money because we do not go to the hospital as we formerly do.
Apia Selassie is a physician assistant at the St. George's Clinic, the only health facility in the catchment area.
And the cholera and the typhoid infections has reduced drastically because of the community having their facility where they defecate the toilet now, because now they don't defecate openly, so that when it rains, maybe the feces will be washed away by the rainwater, which will infect the crops. Now if we go and buy in the market and we don't wash it, they get those diarrhea diseases. So sincerely, all those cases have reduced drastically. 5 mechanized boreholes and 5 hand pump water facilities were also constructed in 10 communities under the IWASH project, which was funded by Plan Ghana, Germany. Fred Kwame Asari, Joy News.
Well, so let's move on. Divisional chiefs in the Ashanti region say they will resist attempts by any individual or group to denigrate the Asante Hene. Otumfo Osetu II in his kingdom for political and other parochial gains. The Bantama Hene, Bafo Wusu Amankwetia VI, warns that any act that seems to run down the Otumfo amounts to attack on the collective interests of the Asante state. He spoke with Ohimi Teria following Wednesday's outbursts by the Otumfo at the MPP executives over reported attempts by people close to government to pour scorn on Asante Man and pitch him against the people of Achim.
MPP officials were at the Menchia Palace to pay homage to the Asante Hene, Otumfo Osetu II. Acting General Secretary John Boadu sought Otumfo's blessings in his bid to secure confirmation as General Secretary of the MPP. Led by Regional Minister Simon Osei-Mensah, the executives fell on their knees to apologize to the Asante Hene. Asante chiefs are unhappy about what they say is via campaign to run down the Asante Hene and his kingdom. Bafo Owusu Amankwetia VI is spokesperson.
We heard Otumfo yesterday, what happened at Menchia. I mean, it speaks volumes of whatever has been happening. But this is an issue that everybody knows about. And I believe that the time has come for Nananom to call a spade a spade. Because we believe that Otumfo doesn't collect taxes in Ghana. Taxes are collected by the government, and these taxes are supposed to be used to improve infrastructure in the country. We are saying that we are not getting our fair share. So if you sit somewhere and think that it's Otumfo who has to repair roads, and for that matter, you can go about saying anything about our king is something that we will never tolerate. So I think what happened at Menchia yesterday, I mean, we think that Otumfuo has spoken, and he has, expressed his feeling on this matter in a very, very serious manner. And I hope that people are going to take cue and going to show the respect that is due Menchia. For us, there's only one king, is the Ashanti. That is what we know. If somebody is trying to put a certain chief above Santini, fine. Me, I don't want to know. Because we Ashantis, our loyalty goes to our king. We protect him with all our might. And we make sure that his will always prevails. So that is Ashantis. He tells us to sleep at 6 a.m. You come to Kumasi, nobody gets out after 6. That is the respect we give to our king. That is our loyalty to our king. If you play with an Ashanti, you can do everything with an Ashanti, but don't play with his king. That area, when you try to go to that area, you'll be in trouble.
He also hit back at critics who accuse Otumfuo of doing little to develop Ashanti region.
Head of the African Desk for the International Consortium of Investigative Journalists has charged civil society organizations to do more to protect journalists in the line of duty. Journalists across the world continue to encounter threats and brutalities in their bid to expose corruption and other ills in society. And speaking to JoyNews on the sidelines of the World Press Freedom Day event that took place here in Accra, Will Fitterborn said the various civil society organizations should stand up for journalists facing persecution. His journalist, Anas Aremeyaw Anas, on his part, called for greater collaboration among journalists across the globe to fight crime due to the sophisticated nature it is being adopted all over the world. MFA Tiamo Eli has more.
The company shut down.
Will Fitterborn, who heads the African Desk for the International Consortium of Investigative Journalists, says the world's civil society organizations benefit immensely from the work of journalists and that standing up for them should be their way of appreciating them.
If you read and consume news, if you enjoy Joy FM or any other local or international media, we as consumers, I think, have an obligation to make it clear to our leaders that we will not tolerate abuse of government.
As journalist Anas Aremeyaw Anas, sharing his experience as an investigative reporter, said collaboration among journalists across the globe to fight crime has become necessary due to the sophisticated form it is taken.
As journalists, we should rethink our methods. They always want to think and get us. And so we have to be more innovative than we used to be. Once society is developing at a faster speed, we also as journalists have to find ingenious ways of turning around our work, else we risk dying in the field of work.
Head of the BBC World Service for West Africa, Oluwatoyosi Ugonseye, encouraged journalists to be motivated by the impact of their stories instead of being fixated with particular fields of journalism.
Sometimes it's difficult to get the information that would, for big corruption cases. Are we going to say we're not going to do investigative journalism because of that? So I was calling for, can we look inwards more? Can we look at journalism that impacts? Because for me, investigative journalism is journalism that delivers impact, whether it's for one person, whether it's for a group of children, whether it's for pregnant women. I mean, look at the story that the BBC did in Ghana a few weeks ago about the girls who cannot go to school when they're on their period because they're not allowed to cross a river. Do you know the number of girls would that affects daily? And after that report came out, people were asking questions and saying, no, this shouldn't happen.
Meanwhile, President of the Ghana Journalists Association, Roland Afel-Moni, has implored journalists to allow the rule of law to work as they demand justice against anyone who is deemed to have oppressed their freedom.
In this dispensation, ours as journalists is to raise a red flag, is to make the loudest noise about such incidents, and then allow the law and other community to take it up. And our voice should not be silenced, our voice should not be muzzled until justice is done to the victims of such attacks.
Participants will close this year's commemoration with a declaration on the way forward. MFA Ewena Matia Moeli for Joy News, Accra.
And before we go, passwords for modern gadgets like phones and computers have become essentially part of many individuals, including myself. And for many reasons, people cannot just do without them. But have you ever thought of finding yourself in an emergency when you have no form of identification card and your phone has a password in the process? Well, as World Password Day is observed today, Love FM's Anita Sewam Ajogam explores the complexity of identifying people in times of emergencies while they have their phones on one hand, but those phones have passwords.
How often do you carry your ID card around?
Normally I don't carry it along with me. Only when I'm going to do something special with it, that's why.
I don't really use my ID card.
I don't really carry it along. I don't feel the essence of carrying it along with me, so I don't carry it.
50 unidentified bodies were scheduled for mass burial in the June 3 flood and fire disaster. On November 2017, the police carried out another mass burial for unidentified bodies. 7 days ago, another 120 bodies were buried by the police. The police hospital encouraged members of the public to develop the habit of always having identification cards on them. It is, however, obvious many people see no essence in carrying identification cards. They are expected to carry along at least a formidable identification gadget, a mobile phone. So do you have a password on your phone?
Yes, I have a password.
Yeah, I have password on my phone.
More password on the phone, sir.
So how do you want to be identified in case of emergency or accident?
So I don't think in case of an accident of something of that sort, you could just identify anything out of it.
Oh, okay, about because it won't be me password. This is Nyame.
It will be very difficult to identify me.
Meet bar owner Ya Amponsa. She's a native of Adansi Ekrofom. Yes, I knew that even before asking her. The reason why I have this name tattoo is due to an accident that occurred at Dunkwa Amponyasi. And the only people identified were those with the name tattoo. So their families came for the bodies. The rest of the unidentified victims were buried in one pit. First of all, the ink is used in writing your name. Then the needle is used in pricking you for the medicine to penetrate into the body. Sometimes she gets incensed with it because it makes her easily identifiable. The only problem I have is when I'm easily identified by strangers. So I then ask the person, where do I know you from? Only to realize it's due to the tattoo I have on my arm. How would you want to be identified in times of emergency if you don't have your ID card on you and you have a password on your phone? Maybe the name tattoo should be revisited. Reporting for Joy News, Anita Sewa Ajoga.
Interesting point there. So what do? Keep the password? It's a feature on the phone. I don't know. Anyway, so that'll be it for now. We have to do the newspapers and take a look at what stories we have on the front and back pages of those newspapers, and then look at myjoyonline.com and the other online portals that we have. But please get interactive. Facebook Joy News on TV is a regular page there, and you can watch us live also on our regular channel on YouTube, My Joy Online TV. Myself, Mamavio Sabwaje, will be doing the reviews next, and then we'll have Benedict also coming with the latest with sports. Stay on.